Hello everyone, this is the second video on lymphatic filariasis. In the previous one, we have covered what are the clinical feature, what is the vector for that disease, and what is the pathogenesis for the filariasis. In this video, we will learn about how we can diagnose this case of filariasis and what will be the treatment. So let's start. So in diagnosis, first we have to collect the sample. So the blood sample is being collected, and as the parasite has a nocturnal periodicity, that means the microfilaria, which is a diagnostic form, that when if you want to see, that will chances of detection will be low if you are taking the sample in the daytime. Therefore, we need the DEC provocation test where the diethylcarbamazine is being given, and the dose will be 2 milligram per kg. It is given orally, and approximately 20 to 40 minutes you can, after that giving this drug, you can take the blood sample. So chances of detection increase. Then in microscopy, what test will you do on that sample? That is, one is the direct wet mount, or you can also make the smear, thick and thin smear. So after making the smear, you go for the staining, that is the Giemsa staining or the hematoxylin staining. So like you are making the smear like for the malaria slide. So similarly, you can, the same slide can be used here also, and you can see the microfilaria. Then consultation technique is also available, which increase the chance of detection of this parasite. So it can be either by the membrane filtration or by the North centrifugation technique. Then quantitative Buffy-Coat. So QBC, like we do this QBC in the malaria, similarly we can do here also. In QBC, actually the sample we are taking plasma, and that has to be centrifuged at a very high speed. So different layers will be separate out, like that of RBC, WBC platelets. So in that also you can look for the microfilaria. So this is the microfilaria which you can see, and it's easily visible in the slide after doing the Giemsa staining. This is Wuchereria bancrofti microfilaria, and this one is the Burgia malai. Now we are doing the microscopy, but there are chances as infection is present, but you will not able to detect. That is a false negative. So in case of the occult filariasis, it could be possible because the microfilaria has been cleared from the blood, and in microscopy you are looking for the microfilaria in the blood. Therefore, although the infection is there, but you are not able to see the microfilaria. The second thing, if the sample is not collected at the proper time. So if you are taking the at the daytime, the parasite has a nocturnal periodicity, so you will able to miss. So there should be DEC provocation test. Now second test, we can go for antigen detection. So for that you can go for the immunochromatographic technique, which is being preferred for all these rapid tests. So in this, monoclonal antibodies are being used, and for detecting these antigens, sensitivity and specificity is very good. And what is the advantage over the microscopy? That specific timing for the blood sample, there is no specific timing. You can collect the blood sample at any time, and it is useful in the latent infection also. So you can go for the antigen. Also one more advantage, that in the fields, in the rural setup where no microscope, these things are not available, so you can, in the field surveys, you can go for this ICTs. Then serology, that is detecting the antibody. So in endemic zone, because there are so many non-human filariaworm infection are there, so antibody are present in the person. So cross-reacting antibodies are there, so there will be chance of false positivity. But for the epidemiological surveys and monitoring, you can use that's how many people are affected in the country from this filaria infection. So for those data, you can have this serology testing. In the non-endemic area, you can use it for diagnostic purpose too. Then molecular techniques, PCR or the real-time PCR, you can go for that. It differentiates past from the present infection, And in the carrier also you can diagnose by this technique. And if the treatment is going on for the patient, you can also monitor the response, whether the patient is responding to treatment or not. Then other methods, eosinophilia. So as it is a parasitic disease, there is a high eosinophil count. So you can go, that will be a supportive evidence. Then elevated serum IgE level will be raised. Urine microscopy examination, microscopy hematuria. So in case of, if it involves the like immune complexes being deposited in the kidney, so in that case, if there is a nephrotic syndrome or hematuria, proteinuria is occurring, so you can go for the urine examination. Now, as we know that filariasis can be caused by Wucheria or by the Bergia. So when we are going for the microscopy, we should know the difference between how we can differentiate between the two microfilaria. One is of Wucheria, another is of Bergia. So that is very important MCQ, or that can be a Viva question too. So here you can see the tail end. The tail end of the Wucheria bancrofti, there is no nuclei in the tail tip. Whereas in Bergia, there is two widely spaced round nuclei in the tail tip. So that is the two nuclei in the tail tip present in the Bergia but absent in the Wucheria. Second, in the Wucheria, the nuclei which are present, they are well separated. Whereas in case of Bergia, they are overlapping. So that are the two differences which you should know between both the microfilaria. Now treatment. So drug of choice is diethylcarbamazine, and it is given 6 mg per kg daily for 12 days. Can kill both the adult worm and the microfilaria, and adult worms are cleared slowly. The second drug, albendazole, it is given as 400 mg twice daily for 21 days, and it has also demonstrated efficacy against adult worm as well as microfilaria. In ivermectin, it can kill microfilaria but no effect on the adult worm. Now vector control, as a vector is a mosquito, so you have anti-larval measures, anti-adult measures. In anti-larval, it is highly expensive, but it can be useful in the urban areas. So like mosquito larvicidal oil, pyrethrum based oil, organophosphorus larvicide. Then there are certain environment, like fish, you can use fish for the larva, like gambusia fish. Then anti-adult measures, pyrethrum spray can be used. Now this is included in this National Vector-Borne Disease Control Program. So this program has been started in India since 1955, and it has been integrated in this National Vector-Borne Disease Control Program in 2006. And what massive campaign has been launched, that is the Hathi Paw Mukt Bharat, that has been started. It has massive campaign in 2015 for achieving filaria free India. So that is all. All the things have been covered related to the filariasis. Thanks for paying attention.